and has and has worked with CF patients for 21 years in the inpatient and outpatient settings. And she has worked for UT Health Northeast for 21 years and has been on the CF team for 5 years. Mona Crow.
Today I'm going to talk about the importance of exercise in the CF population. It's important for everybody. Our objectives are going to be to learn about the benefits of exercise, identify some of the medical and nutritional considerations that need to be followed when exercising, and describe some sports and activities that are appropriate for people with cystic fibrosis and other diseases. Much bigger on this screen. The benefits of exercise are to improve strength and endurance, improve airway clearance, which is very important, improve bone density, it improves mental health, improves the efficiency of how your body uses oxygen, builds self-esteem, helps you feel better, helps people breathe better, it helps reduce stress, and the main thing, it helps people enjoy a better quality of life and a longer, healthier life. If you don't exercise, it's not good. You have a lot less efficient use of oxygen, and your body doesn't process it as efficient as it needs to be. You have poor strength and endurance, and it gets worse as people's disease progress, and the more their lung function decreases, the less endurance and strength they have. And you heard Kelly talk about earlier where she couldn't even dry herself off when she got out of the shower. It can get to that point. So the more exercise you do, the longer you can keep doing your activities of daily living and the things that you need to do. It limits your chest expansion. If you don't breathe deep and you don't exercise, your chest gets tight and you can't take a good deep breath. So you have less effective airway clearance. It's decreased bone strength, decreases your immunity and health for fighting off infection. It decreases your endurance for activities of daily living, just like we were talking about. And that includes at home, work, school, for all different ages. And it decreases your ability to control your blood sugars. All people benefit from exercise, but it's very important for people who have some type of progressive disease or a disease that requires that they stay healthy and do whatever they can to stay healthy to prevent decline in their health. So want to try and stay as healthy as possible. So exercising is another component that a CF person needs to do. And it's always good to have an active lifestyle. You have a better quality of life. And for our young children that we see with new diagnosis, we try to encourage the parents to be really involved with keeping the kids active, having them have a normal childhood, be really active. The more active they are, the healthier they stay. If you start a child off when they're younger and with a real active lifestyle, you stay healthier, and as an adult, you're active and you stay healthier that way also. It's really hard to get a sedentary person who's been just watching TV for the whole life to get out and do exercise, because that's a bad habit that's really hard to break. Okay, some of the medical considerations. You need to consult a physician before beginning a vigorous exercise program. And that means like really strenuous exercise, like going out and jogging, playing a really, really hard sport, like competitive basketball, stuff like that. If you're starting a moderate exercise or just gradually working into a more moderate or vigorous exercise, it's usually not that much of a problem that you would have to consult your physician first before you start. But if you have any questions about it at all, you do want to check with them. If you have CFRD, you should monitor your blood sugar before you exercise, and eat a snack if your blood sugar is less than 100. Complete nebulizer treatments 30 minutes before exercise. Some of the medications make your heart race, so you want to let your heart rate go down before you exercise. And also, it helps loosen up some of that mucus that's stuck in your lungs, and helps with airway clearance once you do some exercise, because that helps open up your lungs and you can cough some of that out a little bit easier. Avoid high-impact exercise if you have osteopenia or osteoporosis, because you can have a higher risk of having some type of a fracture. If you use public exercise facilities, a lot of people go to gyms, that go to fitness centers. Make sure you follow the infection control guidelines that the CF Foundation recommends, and most fitness centers have sanitary wipes that you can wipe off all the equipment. Wipe it off before you use it, and wipe it off after you use it. A lot of people go in, they'll exercise without wiping it off, and then they'll wipe it off after they get finished. But you don't know if the person who previously used that equipment cleaned it off before you. So you want to make sure you clean it off first so that you don't pick up anybody else's germs. You can consult a physical therapist at your CF center for personalized exercise programs and fitness programs. Avoid temperature extremes when you're exercising, because people with cystic fibrosis don't deal with heat quite as well as some other people. You want to make sure you follow your doctor's recommendations if you have a port or a PICC line or your G-tube. Monitor your oxygen levels. If your FEV1 is below 50%, or if you're on oxygen, make sure your O2 sats stay above 90 when you're exercising. Make sure you hydrate well, and you replace calories that you burn. Some of the things that Cynthia went over with hydration and calories, you definitely want to replace the calories you burn, because CF people have problems with maintaining their weight. Most people have trouble getting the weight off a lot of times. So they're wanting to exercise and burn calories. But with cystic fibrosis, you want to make sure that you replace the calories that you burn while you're exercising to keep from your weight level from going down too much. Also, check with your dietitian. If you start an exercise program and you notice you're starting to lose some weight, be sure and talk to them about supplemental nutritional high-calorie foods to add when you exercise. And there's a lot of sport drinks and protein drinks and all kinds of things on the market. The one thing you do want to pay attention is if there's less high sugar content and high carbohydrates in a lot of them, if you have cystic fibrosis related diabetes. Okay. Activities that have cardiovascular and pulmonary benefits increase endurance, help use oxygen more efficiently, and assist with airway clearance. Strengthening and stretching exercise help with airway clearance, improve posture, and reduce the effects of osteopenia and osteoporosis. The most important things is people have more success with activities that they enjoy and like, and they can participate with their family or somebody else that's their support system. This is a really busy slide, but it's some of the activities that are good for different age levels. And you want to have a variety of breathing, chest mobility, core strength, and leg strength and endurance exercises. And that kind of covers a comprehensive exercise program. For aerobic and breathing activities, it's on the left-hand side, and strengthening and stretching exercises are on the right-hand side. And these are just some examples. They're not a lot of them, but there's a lot more things that you can do besides this. 0 to 12 months with babies, you want to do supported walking, jumping, crawling up and down stairs, riding on toys, dancing, rolling and chasing balls, strengthening, tummy time, crawling, rolling, sitting independently, climbing, standing, and reaching activities. Anything that gets their arms out and better breathing. 1 to 3 years old, singing, blowing bubbles, blowing, anything that's a blowing activity helps with breath support. Riding tricycles, running, lots of playground activities, and that's when you can start getting them into community sports like t-ball and things like that. And also walking, jumping, stairs, rolling, walking backwards, reaching overhead, throwing and catching balls. 4 to 6 years old, that's when the kids have lots of fun. They have a lot of different things they can get into. Singing, bubble blowing, playing wind instruments at school, swimming, jumping, running, riding tricycles, bicycles, playing games outside for 5 to 20 minutes, taking family walks, dancing, and youth league sports. Specific strengthening and stretching is sit-ups, rolling, climbing on playground equipment, climbing stairs, obstacle courses, ball games. When you get up to the older kids, preteens, a lot of school activities are good. Singing in the choir, playing wind instruments, dancing, swimming, walking, running, bicycling, skating, youth league sports, gym exercises, impact exercise, moderate impact exercise, trampolines, sit-ups, yoga, Pilates, swimming, hopping, skipping, obstacle courses, and then for adolescents and adults, specific diaphragmatic breathing exercises, singing, playing instruments again, swimming, running, basically the same thing as for teenagers, youth league sports, gym exercises, adolescents and adults for strengthening and stretching, yoga, Pilates, tennis, volleyball, gym exercises, physical therapy prescribed weight training, and lots of organized sports. For a lot of kids and a lot of people, organized sports cost a lot of money. The Cystic Fibrosis Lifestyle Foundation does have some scholarship type grants that they have that people can apply for. They have an individual grant that is for the specific person with CF to pay for the fees of if a child wanted to do sports league basketball and the fee was like $120 or something for a season of that you could apply for that grant, and that would pay for possibly the fees and uniforms or something. The Loretta Morris Memorial Fund Recreation Grant, that's more for hippotherapy, dancing, like staying in a dance studio and paying for dance lessons. Peer Support Recreation Grant, that's a grant that would also allow like a sibling to play a sport or become involved in an activity to help motivate their sister or brother to be active. And then they have a mentor recreation grant, and that's for an adult that would need to pay for fees or something to be also involved in a sport with a child so that they could help make sure that that child stays active and gets to those organized sports or organized events or dance lessons or things like that. If you are interested in any of those, you could go to cflf.org and you can print out a copy of the application. I think on most of them, they do need to have a doctor's signature on those, but our physicians here are always glad to take care of those kind of things for you. Free Pilates and exercise videos are are available from the Cystic Fibrosis Foundation. You just email them and they'll send you videos. I have a stack full of them out on one of the tables out in the front that you can pick up, and they're no cost. And the most important thing for anybody is don't force yourself to exercise doing something you just hate. Make sure you do something that's enjoyable, that you can do with other people, and something that you don't mind getting up and going and doing. If you have to make yourself exercise because you know it's good for you, but you just don't like it at all, that's not very motivating. So you want to make sure that whatever you're doing is really fun. And try and get yourself involved with another person, because they can help encourage you and motivate you, and you can encourage and motivate them to also help in good, better physical condition. And the references, I got most of this from the Cystic Fibrosis Foundation. They have lots and lots of reference materials, lots of research, and lots of things to give you information on any of this type of thing. And if anybody has any questions, that's all I have.